but you know, the minute they come in and we're giving them some reinforcement that there's nothing structurally wrong, you know, people can work through this, but you need to reach out and you need to find someone that's going to understand exactly what you like to do so that they don't give you the answer, well, if it hurts, don't do it. So I think on that, we talked about no pain, no gain. We talked about treating thyself in terms of activity modification. I think the other important aspect of this is the application of ice. Ice is a great modality to reduce injury, swelling, and pain. Ice applied to an area, it needs to be protected so that you don't burn your skin. I've seen more than one time an individual coming in with a red mark on their leg where they left ice on all night long and ended up having a second-degree burn. I usually tell people that they should not leave ice on for more than 10 to 15 minutes, and they should cycle that approximately every 1 to 2 hours, somewhere around there. It can go a little bit longer, but you don't need to do, you know, the ice for 10 minutes, take it off, put it back. I think it's just too much time, and you end up needing your skin and the soft tissues to recover a little bit from the coldness. Obviously, elevation, if there is swelling, it can be very helpful. The missed workout syndrome. Gee, you know, I didn't feel so well today, and you know what? I missed my 20-mile workout. You know, I've got a 6-mile run tomorrow. You know, I'm also going to do my 20-mile ride tomorrow also. That is the recipe for absolute disaster. If you miss a workout, you know, it's not the worst thing in the world. It's water under the bridge, and just continue going on your plan. There's nothing wrong with missing a single workout. Again, sleep to recover, it's very important. They talk about sleep deprivation of less than 4 hours of sleep. I hope no one gets, you know, less than 4 hours of sleep, but that's where there are some real changes in the hormonal balance to the body if you get less than that. And, you know, if you look at the pro athletes, they're getting 8 hours solid of sleep, and it's important. So I would make sure that you factor that in. And obviously, eat to recover. We want to, again, take in good calories, healthy calories, so that we replenish all the things that we're utilizing to help us move quickly on a triathlon course. And again, in terms of professional help, sometimes, you know, I don't feel like an orthopedist. I do feel more so like a psychiatrist, but I definitely am a like-minded soul because this is what Joe and I have done for many years. Whether or not you go to a physician or a physical therapist or even a podiatrist for that matter, most of us are all able to make the diagnoses, especially if they are like-minded soul. You need to follow the plan. It's super important that once someone gives you an idea of what you need to do, you need to follow that. Keep an injury log. It's very easy to say, gee, you know, Tuesday my knee really, really was painful. God, you know, the last 2 weeks of treatment really didn't do anything. My knee really sucks right now. If you were to have an injury log where you could say, you know what, I look back and on those days where I was trying to recover, trying to treat myself, you know, I was getting better, and gee, Tuesday was just a bad day. It's a good positive reinforcement that you're actually on the road to recovery. And again, as a last statement that I'll leave you with, and then we can open up the floor to some questions, is that you have to be patient with healing. And I tell individuals, as long as you really have the symptoms, that's probably how long it's going to take you to get better. And that's only with a well-guided plan and with the help of a physician, a physical therapist, a podiatrist, an acupuncturist. You know, there's many people that are available to you out there. You just need to seek them out to get you know, some improvement in your injuries. So with that, unless Joe has a comment that he'd like to make, we'll start to answer some questions. Joe?
Hey, Mark, that was terrific. It's a great overview. Just one comment in terms of the cause of your injuries, and I think that's something that we really have to focus in on. You know, you can have an extrinsic cause to an injury or an intrinsic cause. An extrinsic cause is really that has an injury that has to do with some error in your training, whether you've been too intense in your workouts, whether you've gone too far, your frequency of workouts, the same kind of workouts, you haven't altered your workouts, you haven't altered your efforts. So that's part of the cause, and that's all preventable, and that's what Mark's talking about. Those are things that with an appropriate training logbook, you can take a look at what your training is like, and you can start to vary the amount of effort and intensity of your workouts, and that's really important. In terms of intrinsic causes, you have to start to look at your running mechanics, your own individual biomechanics, where your strength is in terms of core strength. And we talk about core strength, which is extremely important. We're not just talking about abdominal strength. Everyone thinks that, you know, core strength has to do with having a six-pack. That's only part of your core. It's really important to be able to have excellent gluteal strength, and your whole pelvic girdle has to be very, very strong too. And then the other potential cause is a lack of flexibility, especially in running. You know, the muscles in the back get very, very tight, as well as the hamstring and calf, and it's important to maintain flexibility, especially as you start to ramp up your training.
So we're just going to wait for some questions. You can type them in to Allie.
Great. So we have a question.
We do know that this is a triathlon, and we know, I just want to say one thing. We do know that, you know, this is the New York City Tri, and we do know the distances. We do know the course. The only one factor we don't know is the weather. And I think that's going to be up in the air. This is the first time I think that we're this early in the year, perhaps. Hopefully it won't be a weekend like this, but you never know, so be prepared for the heat. Go ahead, Allie.
So we have a question here. Would love to hear any advice for IT band treatment other than foam rolling and ice.
So the interesting thing is that this was probably the most popular question of last webinar. I can tell you that I am not an advocate of stretching your IT band at this juncture of treatment of IT band friction syndrome. What we've learned, and this has been supported with a lot of my friends who are physical therapists, is that there's often some other inherent problems in terms of tightness around the hip joint, the lower back, the hamstrings, that are really the causative agent of a lot of this. And that, you know, in essence, if you try and foam roll the IT band, you really don't stretch it out. Sometimes it will actually aggravate it. Some of the physical manipulations that individuals will do to the IT band actually are very painful. And what we've noticed is that if you really address the muscle imbalances and some of the other intrinsic contractures, whether it's the ankle, the knee, and the lower back, and even the hip, that will help correct it. That's flexibility standpoint. From a muscular standpoint, as Joe alluded to, you know, strong core strength is really the key, and I will just make a blanket statement that I would say for almost every overuse injury that we're seeing right now, it's due to a core weakness. And whether that's your abductors, whether that's the abdominals, the lower back, the quadratus, there's a variety of muscles that are there that are really our core muscles that are not generally addressed, you know, in triathlon training. Without taking care of those muscles, you lead yourself down the road of having an overuse injury like IT band friction syndrome. And again, you know, the standard treatment from my perspective is reducing some inflammation. So your IT band, again, rubs against the bone called the distal femur on the outside, and there's a little sac of fluid called the bursa. That bursa gets very inflamed, and the classic story of someone with IT band is, I'm running, and at 1.1 miles or at 3.7 miles, my IT band starts to tighten up. I usually have to stop because it hurts so much, and as I stop and feel a little bit better, and maybe I stretch a little bit, and I start to get going again, it feels as if someone takes an ice pick and sticks it into the side of my leg, and I cannot, you know, continue. That's kind of the classic IT band. So we reduce inflammation with icing. There are scenarios in which we have injected these with some cortisone. Cortisone in this location is actually an acceptable location. It helps reduce inflammation of the bursa. And for cases that are refractory to treatment, meaning that if they're not getting better 6 months to a year and you're really incapacitated, there are surgical procedures to do to so-called release the IT band, or at least address some of the friction that can be caused at that point of contact. But I'll tell you, before doing that, you know, making the diagnosis, again, an x-ray usually doesn't show it. Someone who's had significant symptoms should probably get an MRI at some point. But I'll come back a full circle and say I'm not a fan of stretching just the IT band with foam rolling. I think you have to address inflammation, and that's with ice an oral anti-inflammatory and sometimes an injection, and working on things that don't seem to bother it. And that's core strengthening, that's riding a bike, maybe doing the elliptical instead because it's not as impact loading, and working through this. But it's a very difficult problem. Joe, maybe you just want to address kind of lower extremity mechanics.
The biomechanics of IT band are very interesting. It's one of those, looking at the ground up, it's one of those problems that has some interesting biomechanics. There are a couple things that I see frequently with with athletes that have got iliotibial band syndrome. One is we take a look at leg length, and frequently IT bands on the shorter side on the individual. And so sometimes something as small as a 2 millimeter leg length difference can make a difference. And so we always take a look at leg length difference with the athletes with IT band. The other thing that I see just about all the time is that the hamstring on the side of the ITB is usually quite weak. So along with doing a lot of core strengthening work, there's got to be some hamstring strengthening work. Is there a role of orthotic devices in the treatment of iliotibial band syndrome? It's fairly limited, actually. If that is individual's only problem, treating the biomechanics with an orthotic device, a custom-made orthotic device, only has marginal benefit. So I would say that take a look at leg length inequality. Some control of the foot is good, and do all the strengthening work, especially around the core and the hamstring area.
Great, thanks, Joe. Any questions, Allie?
Yes. Any advice for a first-timer taking part in this triathlon?
Have fun. Any advice? Well, I mean, I think there's a lot. I mean, I think these are generalized tips that we can also give you, too. One is from the swim standpoint. We've seen a lot of people, and now especially potentially very hot weather, standing on line, waiting to go through their corrals and get onto the swim barge, and they're all suited up in their wetsuit, and they are sweating like a pig, losing a lot of valuable fluid, and they could be standing on line for 45 minutes or so. So the first comment would be, do not fully put on your suit until you are fairly close to the swim barge. You'll have plenty of time to kind of zip yourself up, so maybe time it 2 corrals in front, 3 corrals in front of you that are getting close. That would be my first advice on the swim. Second advice, and again, the swim is probably one of the easiest swims there is in any single event, given the fact that there's such a current that will carry you down, so you could literally float and probably have one of the fastest swim times you've ever had. Getting on the bike is a little complicated in the beginning, and make sure that your gearing is correct coming out of transition. That would be small ring in the front and the largest ring on the back, or they're close to it, because as you start to ride north on the little path, you're going to make a very sharp right-hand turn to get you up onto the West Side Highway, and if you're in a big gear in the front, you're going to topple over like Tweedledum, and you will fall, and we'll see you there at the medical tent. So you don't want to do that. You want to have the gearing, completely correct. At that point, you'll be up on the course, and certainly, I think on the bike, that's where you're going to try and get in some of your hydration, a little bit of fluid, a little bit of food. It's actually a fairly hilly course. The beginning is very flat. The middle is pretty hilly, getting you up through the beginning of the Bronx. And when you come back, again, this is all about safety and having a good ride. We'd love to think that the West Side Highway was the most beautiful road in the world, and it is. But there are certainly potholes. That's part of New York. But when you start on the run, again, you will come into transition, and again, it's a fairly steep descent into transition. We're going to have some hay bales there just in case we need to catch you, but you'll go slow. There'll be plenty of people telling you to, take it easy as you go down there. Races are usually not won and lost in that transition, but you just want to be safe as you go through there. And on the run, I would just enjoy the crowds that are there. They're great crowds.